Many people still hold on to the belief that oral sex isn't real sex. It is often viewed as a safe alternative, a loophole, or a foreplay activity that carries no significant consequences. But what almost no one tells you is that oral sex can transmit the exact same diseases as penetrative sex. In fact, in some specific cases, the risks involved are actually higher. The most concerning aspect of this reality is the silence. Many of these infections are completely silent. A person gets contaminated, feels absolutely nothing, shows no symptoms, and only discovers the problem years later. By then, they may be dealing with severe complications or even the emergence of malignant diseases, such as cancer. Today, I am going to walk you through the primary risks involved with the practice of oral sex. We will look at the most recent scientific data on this subject, and most importantly, I will explain what you can actually do to protect yourself. Make sure you stay until the very end, because the final risk I'm going to discuss is something I believe the vast majority of people have never even heard of, yet it is incredibly common. First, let's establish the basics that are rarely explained clearly. You have to understand the biological environment we are dealing with. The mouth is an extremely rich environment when it comes to microorganisms. It is estimated that there are more than 700 different species of bacteria living naturally in our oral cavity. This is a normal, healthy ecosystem for your mouth. However, when there is direct contact between the mouth and the urethra, the penis, the vulva, or the anus, that biological balance changes. These bacteria, which are harmless in the throat, can migrate and cause infections in regions that are supposed to be sterile. And that simple biological mismatch is just the beginning. This brings us to the first major risk associated with oral sex, HPV, or human papillomavirus. HPV is a silent virus, and it is transmitted with extreme ease through oral sex. The most serious aspect of HPV is where it ends up. It can infect the throat and the oral cavity, places where most people never imagine an STI would reside. Some studies indicate that 1 in every 10 sexually active men has an oral HPV infection. Recent data from 2023 corroborates the fact that HPV is involved in up to 70% of oropharyngeal cases in the United States. This is a staggering statistic. In some male age groups, these numbers are actually surpassing the rates of cervical cancer. What often happens is a cycle of misunderstanding. A patient might have a very small lesion in their mouth. They look at it and dismiss it as a simple canker sore or a bit of irritation. But in reality, that small spot could be a wart caused by HPV. And here is the worst part. Even without visible lesions, this virus can still be transmitted. In men, oral HPV infection is significantly more common in those who practice oral sex with multiple partners. It correlates directly with risk behavior. As I mentioned, this infection is silent. It takes years to cause noticeable symptoms, and by the time it does, it can result in severe types of cancer, such as cancer of the base of the tongue, the tonsils, and the oropharynx. The second hidden danger associated with oral sex is the transmission of the herpes virus. This is the virus that travels. We generally categorize herpes into 2 types. HSV, one usually causes those little sores or blisters on the lips, what we call cold sores. Then there is HSV-2, which typically causes genital herpes, resulting in lesions on intimate areas, primarily the penis and the vulva. Unfortunately, these viruses do not stay in their designated lanes. One can easily pass to the other location. If a person has an active cold sore on their lip and performs oral sex, they can absolutely transmit the type 1 virus to the genital region of their partner. Conversely, if a partner has genital herpes, they can transmit the type 2 virus to the mouth of the person performing oral sex. According to the World Health Organization, roughly 3.7 billion people under the age of 50 worldwide have an infection of the HSV-1 virus. That is more than half of the global population carrying this virus. The problem is that the virus remains latent in the organism. It stays dormant, asleep in your system, and it can reactivate whenever there is a drop or compromise in your immune system. The third peril associated with this practice is candidiasis, often referred to as thrush. Oral candidiasis is caused by a fungus called Candida albicans. Like the viruses we just discussed, this fungus can also be transmitted via oral sex. When this fungus enters the urethra, it causes inflammation. It leads to intense itching and peeling or scaling of the skin on the penis and vagina. This is particularly common in patients who have lowered immunity or those who have been using antibiotics repeatedly. Recent studies published around 2022 show that Candida can be present in up to 20% of non-gonococcal urethritis cases. These are inflammations of the urethra that are not associated with gonorrhea. Oral sex is a very possible and easy route for this transmission to occur. Moving on to the fourth danger, we have the infections that few people talk about anymore because they assume they are a thing of the past. These are the classic infections: syphilis, gonorrhea, and chlamydia. Unfortunately, these diseases have not disappeared. On the contrary, they are coming back with full force due to sexual habits and an increase in casual encounters. Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum. It can cause a single, isolated sore in the mouth, just as it can on the penis, and it is easily transmitted during oral sex. Then we have gonorrhea and chlamydia. These bacteria can colonize the throat. They can live in the pharynx without causing any immediate symptoms, essentially turning the throat into a reservoir for the infection. From there, they can contaminate a partner. Some studies point out that up to 30% of cases of oropharyngeal gonorrhea, infection in the throat, occur in people who have never had genital penetration. They only engaged in oral sex. And yes, these bacteria, once transferred, can cause urethritis, discharge, and severe inflammation in the genitals, even if there was no genital-to-genital contact. Finally, we arrive at the fifth risk, and this is the one that is perhaps the most underestimated and least understood by the general public: bacterial urethritis caused by common mouth bacteria. As we established at the start, the urethra is naturally a sterile environment. The mouth, however, contains various commensal bacteria that live there normally, like Streptococcus and Haemophilus. During oral sex, especially if the partner performing the act has a sore throat, pharyngitis, or is currently using antibiotics, the balance of that oral flora changes. This activity can transfer these bacteria into the urethra. The result is a condition called non-gonococcal bacterial urethritis. It is an inflammation of the urethra caused by bacteria that don't typically belong there. This can become a chronic issue. It causes a dramatic clinical picture: burning during urination, discharge, and general urinary discomfort. The most frustrating part for patients is that they will go to the doctor, get tested for the standard STIs like chlamydia and gonorrhea, and the results will come back negative. They are left confused and in pain because the culprit isn't a classic STI, but rather a common bacteria from the throat that has migrated to the wrong place. It is a challenging diagnosis to make if you aren't looking for it. So, after hearing all of this, the most important question is, how do you protect yourself? First and foremost, behavior matters. Avoiding multiple partners and casual relationships where you do not know the sexual health history of the other person is the most effective prevention. It is impossible to speak about a healthy sexual life while maintaining high-risk sexual behavior. And speaking of a healthy sex life, protecting yourself from external risks is only half the battle. We know that many men are also silently struggling to maintain their internal vitality and performance, often turning to dangerous pills that only mask the problem. If you are looking to restore rock-hard performance naturally, you need to see this. There is a bizarrely simple, 7-second daily habit involving a specific purple tonic that is helping thousands of men reverse the root causes of dysfunction and reignite their stamina without side effects. To understand exactly how this works, take out your phone and scan the QR code on your screen right now to watch a short presentation about this natural breakthrough. I have also pinned the link to it at the top of the comments below. Don't rely on temporary fixes. Check it out to reclaim the vigor of your prime. You must also be observant. Pay attention to any lesion, sore, or bump on the mouth, lips, or genital region. Do not ignore small issues like ulcers or warts. If you see something, do not engage in sexual activity and seek medical advice. And critically, use protection. Condoms and barriers are not just for preventing pregnancy. bear the shield against these biological transfers. Furthermore, get vaccinated against HPV. The HPV vaccine is safe, it is effective, and it can prevent up to 90% of cancers associated with the virus. It is a crucial tool in your health arsenal. To conclude, oral sex is, without a doubt, a risky sexual practice. It is not a safe loophole. It acts as a vector for serious diseases ranging from herpes and syphilis to gonorrhea, chlamydia, and even potentially invisible bacterial urethritis. None of this is a myth. It is the biological reality. If you found this information valuable, please share this with anyone who might still believe that oral sex is risk-free. It's a conversation we need to have more openly. Stay safe, stay informed, and I will see you in the next video.